So the latest estimates are that 1 in 10 people in the EU are living with undiagnosed HIV. So there's still a long way to go in terms of identifying these people and offering them testing in the places that they are to make it most accessible to them. What we recommend at ECDC is integrated testing, so testing that occurs together with testing for other health conditions. So if a healthcare provider is drawing blood for any reason, that it makes sense to test for HIV. We recommend combined testing for HIV and hepatitis. And we also recommend that testing take place where people who need HIV testing are, and so in the community is extremely important. And we've seen that more and more community testing is available across Europe, but there are many places where this isn't available yet. So we suggest testing in checkpoints and STI clinics, in drug services, as well as prison settings, and anywhere that is seeing a lot of people who may be impacted by HIV. So men who have sex with men, people who inject drugs, people from migrant communities, or anyone who thinks that they may be at risk for HIV. So we still see a lot of sexual transmission of HIV in Europe, and to prevent sexual transmission of HIV, we need to ensure that people have access to very effective tools to prevent HIV, including condoms. So condom provision, but also explanation of how condoms are used, sizing and accurate use of condoms. We also suggest, as part of comprehensive sexual health services, that people be offered pre-exposure prophylaxis for HIV PrEP, where it is useful and appropriate. And we've seen that this is available in many European countries, but the coverage is not very, very high in most countries. And so we see waiting lists for people who would like to get on PrEP who are not able to get on it. And we also see at European level that the WHO target of 500,000 people in the wider European region to be on PrEP by 2025 is, we're only about 40% of the way there, so we have a long way to go. The other area where we see a lot of HIV infections still is in injecting drug use related transmission, and we know that needle and syringe programs are really, really effective in preventing injection related risk, but still many countries have far below the WHO targets for needle and syringe provision, as well as drug treatment. We know that works extremely well, and still see too little drug treatment offered to people who need it across Europe. And so we've just recently launched a guidance together with the European Monitoring Center on Drugs and Drug Addiction on how countries across Europe can provide better services for people who inject drugs. We know that migrants, or people who are born in another country, are at disproportionate risk for HIV, and this is both some people during the migration process, but also after migrating. We know that many people become infected with HIV in European countries. In 2022, about half of the new diagnoses were among people with a migrant background, and so what we know is that there are barriers sometimes to the healthcare access that people have. Sometimes testing is not free, sometimes access to really effective prevention like PrEP is limited to migrant populations, and these barriers are even higher in undocumented migrant populations. So we recommend that such barriers be removed so that people can access the preventative healthcare, the testing services, as well as HIV treatment that they would need regardless of migration status.